Senator from Iowa.
Thank you, Madam President. I come to the floor to celebrate 20 years since the passage of the Part D Medicare prescription drug benefit. So tomorrow, December 8th, is that day. Now, there was a time when the seniors of America on Medicare didn't have access to nationwide prescription drug benefits. So, as I indicated, 20 years ago tomorrow, President George W. Bush signed into law a nationwide prescription drug benefit for our nation's seniors. At that time, I was chairman of the Finance Committee, and I was proud to be lead author of that Medicare Part B. It wasn't even, it wasn't easy. It took several years to bring members of both political parties in the Senate and the House, along with a president, in this case President Bush, to accomplish this monumental task. As I remember, both political parties were blaming each other over a period of maybe 5 or 6 years of why we don't have a prescription drug bill, and probably blaming each other. Throughout 2001 and 2002 and 2003, I led a bipartisan negotiations that eventually produced the Medicare Prescription Drug Improvement and Modernization Act of 2003, which is the official title of that legislation. In 2003, I said this, a quote from that period of time: Medicare is part of our social fabric. We're not only saving it, but we're also improving it. And of course, that still rings today. Today, 52 million seniors are voluntarily enrolled in Medicare Part D plan because it's not a requirement of Medicare. In 2023, 804 standalone prescription drug plans were offered across the nation, with the average Iowan having over 20 plans to choose from to meet whatever their special needs were. Over the lifetime of the program, the average annual Medicare Part D base beneficiary monthly premium has been between $27 to $36 a month. Now, I remember some of the discussions that we were having back there as we tried to develop this legislation. We thought to ourselves we had to be very careful that the initial premiums were not over $40 a month, because we figured that was just too high for anybody to participate in this new program. And we knew, or at least thought at that time, that they would continue to go up according to inflation. But as you can see, after 27 years, the base beneficiary monthly premium is still well below $40 a month, which obviously is quite a surprise to those of us that were involved in that time in writing this legislation, but a very positive surprise. Access and affordability have been a key hallmark of the Medicare Part D program, but so has good stewardship of the taxpayers' dollars. In the first decade of the program, the nonpartisan Congressional Budget Office projected Medicare Part D would cost taxpayers roughly $550 billion for that decade. It ended up costing $353 billion, which was 36% less than the nonpartisan Congressional Budget Office projected in 2003. And most federal projections of costs of almost any government program always tends to be much greater than CBO estimated. So this is another one of those pleasant surprises that have come out of what we thought would actually materialize as we were writing this legislation. I know that seniors have appreciated this nationwide prescription drug benefit and its use of a market-based approach. So market-based approach is pretty important because a lot of people like to have one single government program that dictates to each participant only that one choice, and that's the choice that the government offers. In this particular case, we know that we have had plenty of choices to meet the needs of Americans in different ways according to their like. Recently, I've been told by my constituents how Medicare Part D has helped make their lives easier. Now, there's a lady by the name of Kay from Mount Vernon, Iowa, wrote this: I am 100% satisfied with Medicare Part D. It's given me peace of mind and cost savings that make room in my budget for other living expenses. Julie from Dubuque, Iowa, said this, quote, I wouldn't possibly be able to afford oncology care without this insurance. My advice for Iowans becoming eligible for Medicare: sign up for Medicare Part D. Use a trusted source to navigate all the plans. I'm glad to have choices, not one size fits all. End of quote of Julie. An Iowan who volunteers with the Senior Health Insurance Information Program said this as a SHIP volunteer. That's SHIP is the Senior Health Insurance Information Program. Now that volunteer said, quote, I like to help people find the best plan to fit their needs and their finances. One individual was taking 35 daily prescription medications that would have cost $10,000 per month without Part D. For this Iowan, Medicare Part D was by definition life savings, end of quote. I'm glad Medicare Part D has benefited these seniors. Medicare Part D has shown that empowering patients with health plan transparencies and choice can bring about significant savings for patients and taxpayers. Even though Medicare Part D has been around for these 20 years, I've consistently conducted oversight and worked to make it better for seniors and taxpayers. During Medicare Part D's implementation, I held the Centers for Medicare and Medicaid Services accountable and consistently conducted oversight that ranged from making sure seniors could access their prescription drugs all the way to ensuring taxpayers' dollars were wisely spent. I've also worked to advance common sense reforms for seniors, for providers, and for taxpayers. 20 years ago, we modernized Medicare to improve access to seniors while ensuring fiscal sustainability for taxpayers. I don't know why for sure in 1966 when Medicare was set up, why it didn't include prescription drugs, but I assume at that particular time prescription drugs were about 1 or 2% of the cost of medicine in the United States, or the delivery of medicine in the United States. Today, I think it's somewhere between 15 and 20%. Now, these patient-centered principles that I've talked about can be applied to the latest front in the fight to lower prescription drugs by shining sunlight on powerful drug middlemen called pharmacy benefit managers. By bringing transparency to PBM industry, we will empower patients, employers, providers, and insurers to make informed decisions based on true value, if any, that PBMs provide. When consumers are empowered, they can demand change or pursue better alternatives. Unleashing market forces that foster innovation and apply downward pressure on prices is the way to get there. The Senate has an opportunity to take action to reduce costs for patients, taxpayers alike. We should let the successes of Medicare Part D patient-centered approach guide us. Now, my colleagues are going to say that I took advantage of commemorating 20 years of Part D being a successful program for seniors and keeping drug costs down for seniors to take a whack at PBMs. But I think we all ought to think in terms of these powerful middlemen between the companies and you as a consumer or the local pharmacy. And we don't have any idea what they're doing. We know that they have something to do with setting prices, setting rebates, determining what drugs are in what formularies. But beyond that, we don't know whether the rebates that they give benefit the insurance companies, the pharmaceutical companies, the PBMs themselves, the pharmacies, or you as a consumer. And we ought to know that. Now, Senator Wyden, my Democrat friend that he and I traded off chairing the Finance Committee from time to time, he and I started working on PBMs probably about 5 years ago. We were the only two that were interested in it. But it's reached a stage where at least 4 committees of the United States Senate and 1 committee of the House of Representatives have put out bills to make the opaque environment in which PBMs operate more transparent. Now, we aren't saying that what they're doing is wrong. We're only saying what they're doing. We ought to know what they're doing for the benefit of the consumer, but also for the benefit of the American taxpayer, because through Medicare and Medicaid, government is the biggest purchaser of drugs in the United States, and maybe we can save the taxpayers some money. So I hope, besides being here on the floor of the United States Senate, to praise the Congress in 2003 for passing the prescription drug Part D program for Medicare, that I didn't want to lose the opportunity to urge action on PBM legislation so that we can know what's going on in the pricing of drugs, the formularies, and who benefits from it, because with transparency brings accountability. Now, maybe transparency won't be enough when we're all done, but I wouldn't know where to tell you to go if you wanted to change some law right now to transform